Hey, good morning again, everyone. This is Scott Latchett from PSFK and PSFK Labs. I run the research and strategy. I'm joined here by Lana and Adriana, who are two strategists on my team. We're excited to share with you a sneak peek of the Future of Health Report 2018. Would love your feedback following up on this. If you have any thoughts, if anything was unclear, and excited to share this today and then share the report again in the coming weeks. So let's go ahead and get started. So as we looked at the research that we were doing this year, we were really starting to see a number of things happening. And I think as just a little bit of a sort of setup around the overall industry, I think the big thing that started to come through was two ideas. Was really the next level of personalization, which we're calling now precision care, and the notion that data is taking an even greater role within the context of not only consumer and patient lives, but more broadly into the healthcare system, and that enables a number of things. So let's just take a step back and think about what's wrong with the healthcare system today, or what are some of the challenges that I think we need to overcome. By and large, the notion of data in the healthcare system is siloed. I think we all experience that as patients coming into the doctor. Oftentimes, it seems like we're filling out the same patient intake forms every time. Those are largely sort of subjective and inaccurate notions of our medical history. As a result of that, there is really no baseline, certainly that the patient has access to, but by and large, it seems unclear that the healthcare system as a whole has a full holistic picture of who that patient is, and the information that is being shared is often inaccurate and is very archival. I think what we'll see today is that the notion that the ability to sort of understand who an individual patient is becoming much more dynamic, and truly a more holistic reflection of who that individual is. Treatment is based on sort of broad generalizations, what's worked in the past for patients like you, and oftentimes, particularly when introducing a new treatment into the system, is largely based on trial and error. While the notion of cracking the genome and the importance of DNA is extremely important, that is, in our view, just one other sort of critical data point within the context of the larger consumer lifestyle. And we think that that we'll see a larger pool of data being gathered from the consumer, the community, to become a much more integral part of that whole picture. So let's just take a step back and look at the healthcare consumer today. I think it's really interesting to see that in the US, the number one priority for consumers is that personalized experience. And I think what we're going to see today is that now there's an opportunity to take the information, the activity of that patient, and start to use that to deliver not only personal care in the sort of traditional sense, but really start to deliver targeted and precise care that was previously unattainable. More and more consumers are taking an active role in managing their health. Still a small number, but certainly growing in terms of how consumers are using healthcare devices, wearables, IoT, et cetera, to take an active role in managing their health. And they really want that data to start to inform their healthcare experience. And I think as we'll see today, there's a number of different ways that can begin to play a role within the healthcare system. One of the challenges certainly is for the healthcare system to be able to bring that data in and interpret that in a way that will be meaningful. Again, a large percentage of consumers want providers to have a complete picture of their health, and that will sort of get us past that notion of different providers having different aspects of that consumer, and start to have the full sort of holistic awareness of who they are. And the beyond sort of an individual consumer wanting that, taking an active role in their own health, they feel like they should have a role in determining the care that they receive. And a large percentage want access not only to their own health records, but to really have a collaborative role, more so a partnership in working with doctors in that space. So how does this translate into some bigger shifts that we're seeing? Really, that sort of digital transformation that will take the healthcare industry into the next evolution. So again, the notion that patient records are stagnant, incomplete, and tend to be more archival. They get updated only when a consumer comes in for a checkup. Now we're seeing that shift to something that's much more continuous, ongoing, and is creates a bigger picture of, or a more complete picture of who that individual is. And so we really like this notion of the personal API. Rather than filling out paperwork when you come in, there's a digital download, and based on the information that's contained within this dynamic API, a number of personalized and precise experiences, products, services are begin to build off of that. Certainly, the notion of treating a symptom is still going to be important going forward, but again, thinking that taking those symptoms in the context of that data experience and using that to really sort of hone in on making the correct diagnosis, and using that as a way to make better treatment recommendations as well. We like certainly going into the doctor and having that sort of one-to-one assessment is not going to change, but more broadly, doctors and healthcare providers in general will have a much broader access to intelligence that exists in the cloud, whether through AI and machine learning, or being able to connect with their colleagues to sort of tap into their expertise. So that notion of cloud diagnosis, where you're not just getting one opinion or one diagnosis, but you're getting that from a broader group of individuals and entities. The over-the-counter medications, again, are sort of created for the general demographic and are meant to sort of be to treat a disease in the best way possible. However, we're starting to see that as manufacturing changes and the ability to custom produce medications at scale and in a cost-effective manner, will be able to take into consideration that individual patient, the illness that they're suffering from, and begin to customize dosages and think about other things that can be contained within that medication and be delivered to them and be much more effective. The acute treatment notion of really only interacting with the healthcare system when you're going into a doctor's office or a hospital or what have you is certainly starting to broaden with the introduction of mobile and remote care. But we see that even going a step further with IoT sensors, et cetera, helping complete a much more continuous and ongoing sort of notion of what healthcare will look like going forward. And it will sort of seamlessly happen in the background, and where necessary, experts and healthcare providers will step in. And again, that notion of the silo of how information exists around patients, around studies that are happening within different R&D centers, et cetera, will be opened up and be much more broader notion of real-time clinical intelligence, which will inform all of our interactions going forward. So this takes us to the overview that we're going to be sharing with you today, and we haven't quite figured out what to sort of title this particular graphic, but we really like this notion that this will be a precise cycle that will begin to happen around the way that care is delivered, and that notion of a living database is really how data is getting into the healthcare system, both from patients and within the sort of traditional notion of healthcare itself, to augment the understanding of who that individual patient is, and continually update and create a much broader picture, which can then be interpreted through this dynamic analysis. A lot of that is being driven by AI and machine learning. Once that baseline is established, being able to then interpret that data and draw deeper conclusions to then deliver a precision level of treatment. And we see that precision treatment really sort of manifesting in two different ways. Really, how, again, you're able to sort of harness what the individual patient's body and genetic makeup is, enables, and really sort of build that going forward in an entirely new way. And then the role that certainly tech plays within this, how these tech enhancements through manufacturing and through the introduction of custom technology and coaching really sort of elevates the level of treatment and care that you can deliver. And again, all of these treatments then feed information back into the system, and it really creates this holistic driving pattern going forward. So just as again, to see the trends that we're going to share with you today at a higher level, we'll take you through 12 trends today. With each of these trends, we'll share a couple examples of how we see this manifesting within the marketplace. At the end of each of these three sections, we'll share some implications that we see shaping these ideas going forward. And then at the end, we'll just leave off with some larger strategic takeaways that we've developed at this stage.
So as Scott mentioned, this is Adriana speaking. We're going to start with this idea of how do we build a living database for each patient and each individual that can grow with them as their personal health evolves, as changes are made both inadvertently and voluntarily, and how that is constantly communicated to the team of healthcare providers, as well as brands and partners who are providing whether that's wellness goals or personal health from both physical, emotional, and mental. So the first is this idea of how do we understand the context? I think that we've spoken before in previous reports a little bit about collecting data very, very discreetly and directly from consumers. But at the same time, we want to talk about what ambient gathering looks like. How do we understand the context in which a patient is living? Context in some key points, whether that's environmental or lifestyle, can be more determinate of how a patient's health or wellness lives on, more so than their actual decisions or their DNA. So when we're looking at how we can ambiently understand and aggregate information about the context or environment, the first is really an interesting aspect of ambience that we're excited to talk about as it relates to diet and thinking about how we eat. So Nippon Telegraph and Telephone Corps is a Japanese company that is presenting a novel solution as to how we can track food and the calories that individuals are ingesting by actually measuring the arm movements or the wrist movements of individuals. So this is a wristband that estimates how many calories a person is using by monitoring via gyroscope and accelerometer their arm movements. And this is able to understand exactly the speed and the weight of something being used, and can move across a menu of items to determine which, from everything from curry to rice to sandwiches, etc. So the idea here is that by noting the volume or the amount of food and the duration that you're eating it, as well as the time that you're eating it, you can have a more holistic understanding of what your dietary patterns are that can oftentimes be more effective and accurate than self-reporting. So again, this ambient gathering to understand the context of when you're eating and how that's being into your lifestyle, how that's moving into your lifestyle, can help create a more honest opinion than something that might be forgotten or have a reporting bias, etc. And then even at a more passive level, Upstream Research, this is a company that we've profiled on PSFK as well. But very interesting here, it's a platform that provides information about both the environmental toxicity or the environmental status of different regions, locations, neighborhoods, and compares that in relation to the disease rates in those neighborhoods. So understanding that we're investing all this money in drug therapies in our healthcare systems and mapping DNAs, but the second biggest contributor to both societal community health is actually the environment around us. So this is an opportunity to map out what different pollutants are in the air for different areas, what different factories are there, if there have been any spills, etc., soil contents, again, water and air contents, and mapping that directly with data rates for cancer, obesity, diabetes, heart disease, asthma, and even socioeconomic factors. Again, this is meant to be both preemptive to help individuals determine the context of where they're living and or where they're choosing to move, but it's also meant to be a tool for individuals to be more proactive about cleaning up their communities or taking ownership of their communities by exposing them to the data that does have a direct effect on their health. So again, this ambience can be both a way for us to more accurately report in day-to-day life, but it also allows us to take more control of the context in which we're living. So again, that ambient area is very important here.
Thanks, Adriana. This is Lana speaking. And Adriana spoke a lot about gathering ambient data, but it's also important to track personal data of every patient. And to do it so much passively and in the background, and to gather data points around key biometrics to create that baseline of wellness for each patient. And it can help with progression, monitor progression of different treatments, track recovery, and allow to communicate this data back to the providers. This allows the patient to be in their own environment more so than to be constantly coming into the doctor's office and being monitored that way. For example, they can be released from the hospital a lot sooner if they're able to recover at home, while the healthcare provider monitors them from a distance to make sure that their heart rate is staying consistent, their blood pressure is normal, and etc. Belly beam is a Doppler that tracks fetus's heart rate, and it consists of an application and a wireless device. Mothers-to-be can use this system to monitor their baby's health and how it's developing, and that information is gathered in an application, and it can be shared with the healthcare providers, so the doctors can really see how the baby is developing. And this information can also be shared with the close family members to give them peace of mind. And it also provides the mother with a lot more information about how their baby is doing without going to the doctor for weekly visits, and kind of cuts down that in patient time. Virtra is a system that helps to monitor pre-diabetic patients without going to the doctor. Once you diagnose a pre-diabetic, it's really key to watch your diet and different levels, so they have to be constantly going in and out of doctor's office. And this application allows healthcare professionals to monitor their patients from afar, and they evaluate factors such as carbohydrate intake, blood sugar, and burning of fat. And they can really see that data in real time. For example, they see a spike in glucose levels, and they compare it to patients' food intake, and they might be able to see what's going on there. So they can make those recommendations in real time and provide guidance and support. And this method of constantly monitoring the patient can really reduce the need for diabetic medications and actually prevent the diabetes to fully develop.
And so we've talked a lot in the first two trends about the idea of passive monitoring, both of the ambient environment and of direct vitals. And so now we'll talk about something that we're considering quite interesting, even novel to an aspect, of how actual preliminary tests or basic health indicators checks can be produced by individuals in their homes or using their own technology. And whether that's a mobile application, a wearable application, or an IoT opportunity, what this does is help individuals really inform their self-care, but also is a direct correlation to raising concerns for either a specialist or a doctor's visit. So how can the very baseline test to determine if extra help is needed be offloaded outside of the doctor's office or receptionist room and actually can relieve some burden on the healthcare industry? So the first is Luminostics. Again, this is a Y Combinator company where it's an application that's added to a mobile device that uses the flash sensor in the camera phone, or the camera of the phone, excuse me, to complete an at-home STD test. So again, this is able to primarily works with saliva, but takes a sample and then uses that flash analysis to diagnose over 15 different potentially STDs. So again, this is in very early insight and is meant to then be raised and taken to the doctor. And then on a more consumer level, Warby Parker has been communicating about at-home prescription tests now for a couple years and has been indicating that they are looking into that. So they recently, within the past 2 months, have released an at-home vision test. Again, this is just meant to be a renewal for a prescription to see if a prescription has changed. So this Warby Parker application works in sync between a desktop or laptop and a mobile device. So actually an individual places a credit card or a small card near the desktop. The camera on the desktop recognizes that size and is able to direct the individual holding the mobile phone what distance they should stand away, and then completes a standard eye test. For example, can you read these lines or can you read these letters? And then the individual inputs those characters into their mobile phone. Again, so that is a replacement for the verbal cues that often happen at the optometrist office. So if an individual has the same prescription, a doctor is able to approve that renewal, and then they can go ahead and order their Warbies. However, if a prescription has changed, as we've seen in many of these preliminary tests, rather than make a new diagnosis or update the prescription, the tool suggests or recommends, makes an appointment for the individual to go meet with an optometrist. So while we see that this is a really emerging area in terms of individual diagnoses or individual assessments, we see that a lot of these technologies, if there is anything out of the ordinary, will recommend or immediately connect to a healthcare professional. So these are at this point very supplementary tools rather than directional tools.
Yeah. So just as a sort of recap of what we've seen, again, I think what's interesting to note is that there's still that notion that when you go into the doctor's office, you're going to receive a battery of tests. Given whether it's your annual physical and or being tested for a specific set of symptoms that you're suffering from. But now we're seeing that being supported by a much broader track of data that can be gathered on an ongoing basis. What we'll start to see in the second section is how that wealth of information begins to get interpreted at a scale to really make it actionable. But there's that sort of notion that it's everything from the broader context of users' lifestyle, which is often much harder to track and sort of consider alongside things that begin to touch more closely to that consumer and or that patient. Things like the sort of general tracking of specific lifestyles, as well as then even giving them the ability to start to take some of these initial tests as part of that healthcare system. Again, empowering them to take a more active role, and then starting to help them interface with that system. So I think some of the things that that I just want to highlight here are thinking about how all of this information at both a consumer level and or once it's in the healthcare system begins to become much more meaningful and actionable. And I think, again, with sort of on a consumer side, a lot of this information sits in its own separate silos, and it's hard to make correlations or connections between them. What we're starting to see happen is a move towards these dashboards or sort of consumer level databases that start to make sense of that and begin to make recommendations to consumers that help them be more active in prevention and being smarter about lifestyle decisions. Alongside of that is the ability to then communicate that information in a meaningful way back to the healthcare system so that there can be a level of ongoing monitoring and diagnosis. And then once that begins to get automated in the back end, providing a level of sort of autonomous follow-up and care. Again, thinking about that notion of the omni-care that we talked about earlier.
So we established all this data is being gathered around the patient, but now we're moving towards how's that information being used. That extra level of analysis is happening, and one of the ways is that training all these technologies that are happening around you to create that patient's health baseline through background monitoring platforms, and they really are becoming a lot smarter in detecting what is out of norm for each individual. They able to recognize different patterns between physical and mental qualities, and to notify the individual first and foremost that there's something going on, and the healthcare provider to make sure that they check in with their patient. WeGate is an actual device router that analyzes wireless signals that happen around each individual in order to determine if their walking speeds. This is very helpful for elderly patients to make sure that they are not degressing. So they're not digressing, and the way it works is that it taps into the wireless connections within the home, and it's able to read the wireless signals and how they reflect off the body, and it's able to determine the walking speed accuracy within probably around 95 to 99%, and the person doesn't need to wear an extra sensor or carry it with them. This helps to establish any early signs of illnesses and diseases, and contacts the healthcare provider to make sure that the patients are staying on track. Expert is doing a little bit of a similar thing, but for diabetic patients. It's an algorithm that tracks hypoglycemia that is able to predict when it's going to happen and prevent diabetic attacks from happening. It monitors micro movements that are already a part of sensors that are in our phones, our wearables, and other medical devices. And it combines those data points with environmental and digital biomarkers to detect any critical events that are about to happen. Healthcare professionals can use this analysis to make better informed decisions about their patients and how to help them monitor and manage their condition.
So an interesting point that this detection or this diagnosis section really focuses on is the idea that a lot of times when we enter the doctor's office, that insight that we bring in, whether that's providing symptoms or saying if something is irregular for us, is oftentimes subjective, and we aren't really able to quantify that, whether that's reporting bias or whether that's we were not really able to communicate exactly what our symptoms are. So whether that's understanding how data deviates, or more specifically, actually using natural language processing to parse through an individual's description of the symptom, this is what we'll talk about in this trend, is this idea of using machine learning or artificial intelligence to provide the first level of a consultation for an individual. This allows to provide a more objective baseline for what a symptom is and really get to that first core point of assessment and diagnosis that a doctor can then build on, knowing in the context of the individual. What we're really seeing in this space primarily is the use of chatbots. Again, chatbots help us not necessarily to make that diagnosis or make prescriptions yet, but they're at the point where they can narrow down exactly what a symptom is and move from a subjective statement that an individual may come with, I have pain, to being more specific and more objective about what that actually is. So Baidu, a Chinese web service company that you probably are familiar with, has invested extensive amounts of resources, both by employing a medical team and also in building out a natural language processing system that asks questions to narrow down patient interest and info. This is in part of their Baidu Doctor app, which is a more holistic ecosystem that allows individuals to schedule appointments, etc. What we're going to focus on is this ability to synthesize what the symptoms are. So the chatbot is able to actually ask follow-up questions that usually a nurse would ask, or a first level intake specialist at the receptionist or at the doctor's office would ask, including, you have pain, where specifically does it hurt, how often are you having it, etc. Then this is able to transmit data later then to a follow-up provider. In doing so, it's also able to build a library or archive of different symptoms and understand more specifically how to parse or specify those follow-up questions. So again, knowing that Andrew Ng, which is one of the first chief scientists of this Baidu project, made an interesting point, knowing that when a patient often comes in with a concern or a query to a doctor, their first time of describing that is not good enough. And so how can we use machine processing or natural language computing to make sure that that first level of intake, however short it is more accurate and more actionable for the healthcare provider? And how do we make that a little bit more actionable for the individual themselves? This is Buoy, a process in the United States, a chatbot that is here to do something similar, both in asking those first level questions, etc. But this is meant to be more specifically for head colds or smaller illnesses, for example. But it's supposed to help advise an individual whether they should go see a doctor or whether they can stay home and take care of it themselves. Something that we were really interested in reading here at PSFK was about how an individual can really determine if they have strep throat or not and need to go to a doctor for an antibiotic, or if they just have a sore throat. Again, for example, this is a great idea of how things can be a bit ambiguous. If an individual has a fever and doesn't have a headache, then they're likely to have strep throat, for example. If they do not have that, it may be a sore throat or a cold. So by asking these first levels questions, we can really offload some of the extraneous appointments that are being made at doctors' offices and helping individuals understand when self-care is more than enough. So again, this is Buoy's idea here, is to offload the unnecessary appointments at the doctor's office.
Doctors usually have to go seek through a lot of data points that patients provide them, such as various tests, scans, and they really need help to kind of decipher through all of that information to really get to the diagnosis and the treatment plan. And by utilizing artificial intelligence and algorithms, they're really able to offload a lot of the initial diagnosis to the technology. IBM Watson, artificial intelligence machine, they've been in use a lot for different reasons, but their health portion of, they're really utilizing this as a way to figure out and diagnose heart disease. And they're using a lot of different types of medical data that patient has to find out if there's further testing needed for a heart condition called aortic stenosis. And what Watson does, it reads through cardiological medical reports. It remembers data from other sources of medical information like x-rays and ultrasound. It also looks at the pictures of the heart, and it's able to determine if a patient really needs to see a doctor and needs further testing for this specific heart condition. This is a first step, but they really can be used for breast cancer, other heart conditions, and and they're really looking into diabetic vision degradation because it's really easy for the machines to recognize that. And actually, this works very well because Google DeepMind is actually really focused on training their artificial intelligence to look for vision deficiencies and for diabetic patients. And the way it works, it analyzes vast amount of retinal photos that have retinal deficiencies, and allows them to detect early signs of going blind. And actually, those things are easily preventable in about 98% of cases. The reason they're not is because the doctors can't really go through as many patients as their problems. So by using this technology, AI can scan millions of pictures, similar how they scanned they recognize faces in the photos, and able to differentiate those slight differences and help the doctors to diagnose those conditions earlier. And this is super helpful in developing countries because there's not enough doctors to go around and diagnose all the vision problems, and this can be the first level of screening for them.
Yeah, again, to take a step back and think about what we're sort of pointing to in this section is none of this necessarily is talking about replacing the doctor or the healthcare provider within the context of the healthcare system, but it's really augmenting their ability to do their job in a compelling and accurate way. As we saw in that first section, there's that ability to establish a baseline around patient lifestyle and then potentially pick up on deviations as a first level of defense. Similarly with the AI consultations, it's all about thinking about how you help a patient more accurately report what's wrong, really consider the time that can then be spent one-on-one with that particular doctor, and really take advantage of that to have a much more meaningful interaction. And then similarly with that last section, there is a huge amount of expertise within an individual doctor, but imagine if they could then take all that information, look at the individual patient, and then compare that to a huge database of information to then make the most accurate and meaningful diagnosis for that individual. So, certainly we see the that sort of machine learning or that AI playing a huge role going forward within the healthcare system. I think right now what we're seeing is that there's the ability to take a step back and begin to really train these machines on how to do their jobs better, figure out exactly how that fits into the care system. Does that require an additional individual within the doctor's office to be that sort of data scientist or what have you? And really sort of change the relationship that we have with that healthcare system. So again, I think what we think is exciting here is to augment the human element within the context of healthcare, really make those one-on-one interactions much more meaningful, and then use that as a way to then build off of what we know about the patient and deliver a better level of treatment or care.
And so now we'll discuss, once we have an understanding of a consumer or a patient's ongoing data, and we have a more quantified first step as to understanding exactly what the diagnosis is and the ability to make more accurate and more immediate assessments of an individual, how can we move forward to make the most actionable treatment plans that work in conjunction with the individual's both genetic makeup as well as their larger lifestyle? So this brings us to the section of precision treatment. Again, this is a term that has been used within the industry, both specifically precision medicine, but we think it really extends outside of just understanding an individual's DNA. So we'll kind of split this into two sections. The first is the focus on bioharnessing. How can you actually use an individual's both genetic and metabolic as well as microbial processes to work in conjunction to create a truly personalized, at that cellular level experience. But then also, how can you work with an individual's lifestyle, within their ability, and within manufacturing processes to create a truly tech-enhanced experience? So we're not just going to stop at medicine. How can we create a more holistic treatment plan that doesn't just involve actually altering a cellular makeup? So we'll start with the bioharnessing focus. In this area, we'll really focus on what I think is very interesting for a lot of individuals, which is a genetic influence or a genetic prescription. Here, understanding that DNA sequencing or a genetic sequence may one day be our first actual vital sign. And newborns can be sequenced within their first week of life. And knowing that sequence does not change, but gives us so many ongoing learnings that we can tap into, both in terms of how individuals process drugs, what predispositions they have, and even in some points, how we can help them improve their lifestyle or make conscious decisions. So this genetic prescription area is both about how we can make treatments and also how we can continue more healthy living based on DNA sequencing. So the first is, Janu, we're seeing a lot of insights into biology and particularly genetic insight in the beauty industry, knowing that 60% of skin aging is directly contributed to an individual's genetics. So Janu is a very high profile luxury brand in this space that for 200 pounds has been offering a DNA-specific profile that helps understand how antioxidant and collagen levels can be created and improved for skincare. So an individual, whether coming into certain specific Janu stores in London or by ordering a kit, can provide a saliva sample that is then sent to a lab, or in the case of the store done on site, actually sequenced, understanding the antioxidant and collagen predispositions of that individual biologically, and then creating a custom serum or compound that helps in the anti-aging space. So again, this idea here that not only DNA sequencing is something we send out to a lab, but is increasingly being done on site, makes this a much more scalable and immediately effective opportunity for both the medical and larger wellness space. And then thinking about maybe lifestyle decisions and how they relate to genes. Cellmatics is one of the strongest data players in the female health space, particularly in the fertility space. And they've recently released a product, Fertility, which is a genetic test that helps understand each woman's ability to conceive and her fertility profile based on her genetic understanding. So again, Cellmatics understands that there is this preconception in the market that's in the 30s, a woman may, the colloquial term is a fertility cliff, necessarily has a more difficulty conceiving. And however, that isn't the case for many individuals. Many women have it earlier, perhaps in their late 20s, or can have it later. So this is a very important part in the planning of a woman's lifestyle, and understanding more specifically her ability. A few years can make monumentous both career changes and lifestyle changes. So Cellmatics is here to help really communicate that ability on a more personalized level, rather than making generalizations or having to address certain issues before or after it may be too late for a woman to conceive at her easiest point.
The human body is built to respond to fight off the diseases and illnesses on its own. And when we've been treating it with antibiotics and different medications that they're not sometimes don't really work because each person is different and they have their own biological processes. So as of lately, doctors have been really prescribing medications and utilizing the body as a delivery system for treatments. And those internal environments have been really key into having more effective and more potent treatments and using body's natural processes as not to disrupt the immune system and work within the biological needs of the person. Just Milk is a device that works, that delivers medication directly to the infant. It imitates a nipple, a breast, and is made out of disposable silicone material, and allows for a simpler and more hygienic delivery of medication directly to the infants via the flow of breast milk. It does two of the things. It works with the natural biological ways of the body, and also encourages the natural and healthy practice of breastfeeding by using the breast milk to deliver those vital medicines and nutrients that baby needs without really interrupting their immune systems and helping them build it up. This is actually really designed to help with infant illnesses and malnutrition in developing countries, since they have less of an access to some of the medications that we have more in the developed world. This one is really, really interesting, and I think it's kind of out there, but it's a new way to fight cancer, and it was developed by Institute for Integrative Nanosciences. It's where sperm is carries out the cancer-fighting medications, and it's specifically designed for female reproductive illnesses such as cancer, endometriosis, or pelvic inflammatory diseases. The way it works is that the sperm is immersed in the active ingredient, and it's forced to swim into this mechanical harness, and then it's released to attack the tumor. This method of delivery of medication is a lot more natural than previous methods, and they've been using bacteria because it doesn't interrupt any type of body biological processes, and the immune system doesn't have to rebuild itself after it. And they found this quite an effective treatment.
And so in this section of bioharnessing, we've discussed not only understanding and shedding more light on individuals' predispositions biologically, we've discussed altering that biology or supplementing it by harnessing those abilities, but now we'll talk about restoring it to its optimal opportunity. So oftentimes when the individual is treated with medication, whether that's an antibiotic, for example, it wipes out what we consider the microbiome, which is the bacterial or the individual state that each patient has, both on their skin, both internally, etc. And so there's a really big push both through technology providers and through this personalization to understand individuals at a cellular and biological level and to help them fortify their very unique profile so that these harsh medications don't necessarily need to be used and further complications can be prevented. So though this may not seem like a very direct personalization play, it might be one of the more ultimate ones, knowing that it really focuses on building up a person's strongest form of defense. And so what we'll talk here is about building that microbiome. Love Wellness, this is a female wellness brand that has both for its branding and for its mission become quite strong in several different communities. But what this focuses on is the idea that each woman has her own specific microbiome in her reproductive system, and Love Wellness is there to help fortify that and bring it to its absolute natural state, both for the health of the woman across a variety of different points. So this feminine hygiene products really work to foster healthy bacteria in order to fight infections, both for yeast infections, bacterial vaginosis, and others. 75% of all adult women in the United States suffer from some sort of female reproductive infection at a point in their life. And again, these pH balancing points are here to not only reduce any stigma around discussing that, but also promoting that healthy bacteria as a very positive opportunity for female wellness. And maybe perhaps a more active use of this or acute use of this, rather than outside of general wellness, is actually using an individual's own bacteria to create medications that target certain conditions. So at the University of California, UC San Diego, the team there is working to create personalized probiotics that specifically treat eczema. So eczema in many individuals is brought on by an excess of certain bacteria or an imbalance between two separate bacteria on the skin. And the most effective treatment for that is to restore an individual's opposite bacteria into the space. So in this specific study, the team of doctors was able to harness and then grow a certain amount of the opposite bacteria that was being depleted on this individual's skin, create a lotion, and then that was applied topically by individuals outside of the clinical setting 90% of them saw a full reduction in their eczema symptoms, again showing that harnessing this personal microbiome and restoring balance is an effective way to treat some chronic conditions that are often currently being addressed through very harsh medications.
So now we're going to switch gears and talk about those technology enhancements that are happening. And the first one is about manufacturing of those medications and treatment plans. A lot has been happening in this space, and by investing in IT and data structures, wellness brands as well as medical providers are been able to adopt their developmental and manufacturing processes to create that one-on-one product delivery and offer it to a mass audience. Multiplayer Labs is they're a vitamin company, and they determine what are the best type of vitamins are needed for each individual and how that's determined is by taking a 3-minute lifestyle quiz, and it establishes patients' personal characteristics and needs, and then a mapping algorithm design a customized pill that has exact combination of the vitamins, minerals that are needed. The pill is then 3D printed, and it's actually designed to release tailored compounds at a certain amount of time during the day. And those vitamins are shipped about every 2 weeks, and this formula can be adjusted around every two weeks to allow for the changes that are happening in the person's life, such as schedule, their nutrition, and the various health changes. Stratus is working together with VA hospitals throughout the United States to create this network of creating custom prostheses for the veterans. 3D printing really allows for them to create those personalized prosthetics, because it's really key in that area to have something that works just for that patient. And the 3D machines allow for more accurate anatomical models to be built and to iterate the products a lot faster, and they can be modified and be consistent with the patient diagnosis. This kind of avoids any patient ambiguity, and it removes the obstacles in the patient recovery.
And so as we've talked about developing the products now, both whether it's medical technology, prostheses, or even actual medications themselves, we'll talk about what happens when we're not necessarily using true devices or medications to treat something. How can we use a larger variety of services and think about how we can prescribe services or experiences even to alleviate whether that's pain or to treat certain conditions. So in this section, we'll talk that we've discussed or named Technology RX. We'll talk about less invasive treatments that are more personalized to acutely understand whether it's a patient's pain level or how certain experiences can actually help an individual cope with a condition or find a solution without taking medication. So the Virtual Reality Medical Center is a testing area as well as a treatment center that focuses on how virtual reality and immersive technologies can be used to specifically relieve pain and help in the space of anesthesia. So in one specific study, this VR therapy was focused on supplementing local anesthesia for endoscopies. Again, that's where a tube is inserted or a probe is inserted into an individual's endoscopic canal. And what this really focused on was knowing that even with local anesthesia, individuals were hyper aware of the process. They were usually often aware of the process, and they had a certain gag reflex. By putting individuals within a virtual center, within an immersive environment, they were able to fully disconnect from that, and that rate was reduced pretty significantly to the point where this is now being tested in certain hospitals as well, as a way to really increase patient comfort, to deal with any individual concerns or processes, and to also focus on how we can do that without increasing complications, potentially from anesthesia or other drugs. And we're also going to look at Zelf. This is a platform that we're quite interested in here that focuses on connecting doctors to customized digital healthcare tools, apps, and content. And what this does is this allowed each doctor to specifically prescribe their patients, whether it's a monitoring app, whether that's digital content to help them read about a process and become more educated about a condition, or it can even be an online forum or an online process or experience. By doing this, this allows the doctor-patient relationship to really flourish outside of just the standard prescription, and allows that relationship to extend outside through the next appointment. And by not only prescribing medical technologies and applications, for example, but also content, education becomes an essential as well as prescribed part of the relationship. So here we see that technology is really facilitating an outside of the office patient experience that allows for more educated individuals as they manage long-term chronic conditions or acute solutions.
All right. So using technology to respond to individual conditions and behaviors to provide that remote coaching, monitoring, and support for rehabilitation, and offer that one-on-one attention to each patient. It reduces inpatient time while motivating users and encouraging adherence to the treatments. Pill Drill is a system that reminds patients to take their medication on time. It sends alerts, either audio or visual, to remind people when their medication needs to be taken. It consists of a small hub, a pill strip, and scanning tags, and a tracker called the Mute Cube. And what the patient has to do is take the medication at a designated time. After the pill is taken, they have to scan the pills, the bottle of the pills or the pod that the medication is in, to record that the medication has been taken. This alerts can be sent to family and caretakers or the doctor to notify them if the medication has been taken or the patient is missing their doses. And it really keeps the patient on schedule and in charge of their own treatment. Common Sensing and Wellning are created this platform that monitors patient data to improve insulin adherence. So this is one more example of diabetes, how diabetes is to help people manage diabetes. And it consists of the GoCup sensor that manages insulin dosing data, real-time blood glucose data, and data from the diabetes coaches. All this data is combined in one area, and it's able to identify triggers such as drop in glucose levels or a missed insulin dose. And the coaches are prompted to offer real-time advice to the patients to see what's going on or to help them kind of stay on track. This ability to monitor patients from afar is really helpful to make sure that patients are sticking to their treatment plans, but also kind of provide this holistic view of each patient's diabetic profile.
Great. So that takes us to the end of the trends and the examples that we're going to be presenting. We do have a couple more slides to present, but again, just as a recap of that section, I think, what's really interesting to look at is that once we have that data as a part of the system, and we're using that as a way to then analyze and make the most accurate diagnosis. We now have the infrastructure in place to begin to deliver treatments specific to that individual. And that first section, again, is looking at different ways that we can augment or enhance what the body already does in interesting ways. And then that second section is really sort of looking at alternatives. One thing to note is, I think, specifically around the technology RX, with the opioid crisis going on in the US and elsewhere, I think it's really interesting and compelling to imagine the way that technology can step in and take the need for chemicals or pharmaceuticals away from that pain management. And we're really only starting to scratch the surface of that. So I think that's really exciting. Within the space, we need to consider, again, how DNA gets incorporated alongside that individual patient profile, how that gets fed into the system so that it can lead to these personalized treatments. I think the point that Adriana made about how education in and of itself is a huge component of that treatment process and is often forgotten. It's take a pill and everything should be fine, but really helping patients understand how to manage particularly chronic conditions is a huge step forward. I'm just going to leave off with 5 strategies that we see really driving that data-driven precision healthcare that we see beginning to evolve in the marketplace. The first, again, is really at the center of the thesis of this report, which is thinking about building a 360-degree data profile around an individual. Obviously, that requires a much more nimble healthcare system, the ability to take in information, synthesize that in a way, and then make that accessible to not only an individual provider, but across the system, ensuring that that information is getting updated as a patient moves throughout that system. And then the desire amongst patients to also take ownership of that profile, be able to add to it throughout their daily life, and then have the information and the synthesis around that to really understand more about their own lifestyle decisions. The second is this notion of, we're calling AI nurses and ambient technology to really sort of humanize the care experience. Again, particularly in that second section, we saw the ability for these diagnoses to, and sort of intake and in initial interactions, to really respect those one-on-one human interactions that can happen, so that a doctor can spend less time asking setup questions and filling out paperwork, and more time actually sitting with a patient, diagnosing that problem, and then collaborating with that patient to come up with the best treatment plan. Certainly, again, we're not saying that the healthcare provider or the healthcare expert is going to be replaced within this system, but their expertise is going to be augmented through cognitive analysis and really being able to tap into information, again, analyzing the patient's profile in and of itself alongside of their particular symptoms that they're coming in to get treated, and then how you can use not only their own individual information, but compare that to the body of knowledge that already exists to make a much more informed and accurate diagnosis and treatment plan. Thinking about how the care process, again, is no longer just something that happens within the context of the doctor's office or a hospital, but begins to move beyond and integrates into the daily lifestyle of a patient or a consumer. And a lot of that is being driven by health IoT, which is everything from wearables, these new diagnostic tools, as well as ambient tracking technologies connected to the smart home, etc. And then the ability now to take that information and really use that to drive a customized level of treatment through these dynamic manufacturing technologies. Certainly the promise of 3D printing has been discussed for a number of years. We're starting to see, again, that slowly but surely begin to become more widely adopted. And alongside of that, a number of other technologies in the production and manufacturing space that are starting to that are helping move that forward as well. So that takes us to the end. I want to thank everyone for joining us. Again, recognize that this is the first time we're presenting this information. We would love your feedback on what we've presented. Look forward to hearing all of that feedback, and thanks again.